Will you give us an overview of AXA Health International and the key elements that define your health reinsurance propositions?
Sure. AXA Health International is focused on health and protection risks on a global basis. We tend to support our insurance companies with long-term proportional treaties. We bundle together risk transfer solutions with product design, consultancy, claims support, and additional services to our insurers and their customers.
How does AXA Health International position itself within the global health insurance landscape, and what differences your reinsurance solutions from others in the market?
We really try to adopt a partnership approach with our clients and build long-term relationships. And that we can do that through helping them enter new product segments, new markets, and we're introducing a lot of new ideas into our preferred markets. And one of the biggest differentiation that we have is that we can help our insurance companies access international health insurance through our global hospital network, which we are the only reinsurer in the market to do that.
What is your assessment of the Latin American reinsurance market of today, and how do you think it will perform in 2026?
Specifically in health reinsurance, during the pandemic years, most health insurance companies made more margins because it was very hard to get into hospitals. After the pandemic, we had a surge in claims, and most of our clients and ourselves had negative results in 2022, 2023. And the rates went up, lots of premiums were increased, and we are now in a situation where the rates are very healthy. It's a good margin environment, and we expect this to not continue forever, but to be a good environment for insurers and reinsurers in the health line of business for at least the next couple of years.
What are the main challenges that Latin American cedents present for your company?
The main challenge for us is that most cedents are used to reinsure their medical insurance book on an excess of loss basis, whereas we support on a proportional basis. And so, on a proportional basis, you have the interface between insurer and reinsurer is a lot more complex, and the data flows are more complex, and the cedents are not typically ready for that yet. So we need to help them with data flows. The second aspect is they expect us, the reinsurer, to help them find the right balance between product affordability and access to the most expensive medical technology. Medical technology is very expensive, especially when you go to the US, and that pushes the health insurance premiums up. And we need to find the right balance between access and affordability.
For which types of risk do you believe Latin American cedents require the most support from your company?
Typically, retail products are more complicated. They require more expertise for medical underwriting and product design and claims management, as well as middle market and high-end segments. So retail markets, retail products, and products that are more complex than the mass market offering is where we typically help our clients the most.
Is your company using artificial intelligence in its technical and operational process? If so, what benefits does it generate for cedents?
Yes, at AXA, we were a fairly early adopter of large language models. We have a version of ChatGPT in-house in AXA. We call it Secure GPT. It's completely disconnected from the rest of the internet, so it's really secure we want to keep our information confidential. And this model helps our colleagues all over the world be more efficient in their work, like a co-pilot. We also use AI in the pricing areas and in the claims and servicing areas to improve productivity, and help us develop more sophisticated pricing models, which our clients benefit from.
And finally, what contribution can reinsurance make to help reduce the existing protection gap in Latin America?
Well, that's a very important subject. Something that we made our mission to help close. We want to help close the protection gap. And really, it's two things. One is develop more affordable products that more people can buy, more and keep over time. Health insurance is very important for you and your family to be able to access the best medical treatment. And also, so it's not just affordability, it's also being able to cover pre-existing medical conditions. Nowadays, most people, when they come to want to buy health insurance companies, they're already in their 40s or mid 40s, sometimes in their 50s, and they have pre-existing medical conditions. We have the tools at AXA to help our clients cover pre-existing medical conditions with very sophisticated decision models and give their customers more inclusive coverage, helping to reduce the protection gap.